Alcohol Consumption and
Rheumatoid Arthritis
by Taryn
and Trisha.
What is arthritis? Arthritis refers to over 100 musculoskeletal medical conditions and affects 46 million adults and 300,000 children in the U.S. Arthritic diseases are commonly evident in cartilage and joints, but certain forms may be systemic. Arthritis and its related conditions are a major cause of disability and cost the U.S. economy more than $124 billion annually.
First, we will address the following questions. What is rheumatoid arthritis? Who is affected? And why is it significant? There are two main types of arthritis, osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common form and is commonly described as bone on bone because the condition is characterized by the breakdown of cartilage that cushions bone ends. Stiffness and pain result from bones rubbing against each other. This degenerative condition is generally associated with aging and the wear and tear of life, and can also result from a specific cause, such as injury or obesity. Conversely, the structural deformation and range of motion limitation in rheumatoid arthritis is a result of excessive inflammatory response and subsequent tightening of soft tissues, tendons, joint capsules, and reduced joint space. Scar tissue blocking the joint space may eventually calcify, resulting in total joint fixation. According to the CDC, people with RA have worse functional status than those with OA. Rheumatoid arthritis is an autoimmune disease, meaning that the body forms abnormal antibodies which it is unable to recognize as self. It then creates a second antibody, termed rheumatoid factor, to attack the first. This leads to inflammation, exacerbated by subsequent immune responses of the body, and eventually leading to cartilage damage and joint destruction. Fatigue and weakness often occur from altered body mechanics, and depression as a result of limited mobility. Rheumatoid arthritis is systemic, spreading throughout the body, typically affecting smaller joints before larger ones, and in some cases, having detrimental effects on organs such as the heart and lungs. The disease is also bilateral, affecting both sides of the body in a similar manner. It is known as a disease of exacerbation and remission, as individuals experience periods of normal activity with intermittent flare-ups and pain and swelling. Influences of RA development and progression include those listed here. Viruses may trigger a reaction in some who have an inherited tendency for the disease. Researchers have found a common genetic marker in many with RA. Women are affected 2 to 3 times more frequently than men, and prevalence increases with age. It is aggravated by obesity and deconditioning from a lack of physical activity, both of which are also associated with aging. The CDC's 2011 prevalence estimation is approximately 0.5 to 1%, or 1.5 million Americans. 10% of those with the disease develop severe joint deformity, resulting in disability. As previously mentioned, the condition affects 2 to 3 times more women than men, and prevalence increases with age, with the highest onset among those in their 60s. However, juvenile idiopathic arthritis affects between 70 to 100,000 Americans under the age of 16. The CDC reports that in 2007, there were 2.9 million ambulatory care visits in the United States among people with RA. In 2009, there were 15,600 hospitalizations with RA listed as the principal diagnosis, equating to total hospital charges of $545 million, or an average of $35,000 per person. The median lifetime cost for 25 years following the diagnosis of RA is estimated at $61,000 to $122,000. The disease burden among older adults is particularly significant due to the growing aging population. Impaired mobility, independence, and quality of life, in addition to the financial burden of this disease, merits attention. Now we will take a look at traditional management strategies, as well as one alternative method that has received recent media attention. RA usually requires lifelong treatment to manage symptoms. Conservative treatment includes heat applied acutely to non-inflamed joints or cold applied to inflamed joints. Caution should be used with physical activity during flare-ups to avoid overuse. Few repetitions of gentle range of motion exercises as well as isometric resistance training are recommended during periods of exacerbation, while increased repetitions of dynamic resistance training is recommended during remission periods. One should maintain strength and range of motion to attenuate disability and maximize mobility, endurance, and thus independence. Splints may also help to reduce pain and prevent deformity during flare-ups. A variety of supplements are marketed to reduce joint inflammation and symptoms. More aggressive treatment options include drug therapy to counteract inflammation or blood plasma filtration therapy that rids blood of RA antibodies unrecognized as self. Surgeries may reduce joint destruction and relieve symptoms. Such procedures include arthroscopic synovectomy, total joint replacement, or, in extreme cases, joint fusion.
Pop culture, a new twist on RA. Recently, there has been a rise in popularity about the beneficial claims of alcohol. One such report was published on a number of media sites, including CBS News in July 2012. The article looked at two recent studies that found protective effects of alcohol against arthritis. The first study was a British Medical Journal study, which we will look at further in a minute. The other study, cited by CBS News, was published in the Journal of Menopause and conducted at Oregon State University. This study found alcohol to slow bone remodeling turnover. The conclusion was that women who drank moderately throughout the week were less likely to develop osteoporosis, a condition in which the bones become fragile and are prone to breakage. Does alcohol have an impact on rheumatoid arthritis? The British Medical Journal study, published July 10, 2012, was the primary study on which we focused. It was a 7-year prospective cohort of 34,141 Swedish women, during which 200 participants developed RA. The study found a 37% decreased risk of rheumatoid arthritis in women who consumed 4 or more glasses of alcohol per week compared to those who had less than 1 drink or were non-drinkers. The study also found a long-term 52% decreased risk of RA for women who drank 3 or more glasses of alcohol per week compared to non-drinkers. The findings can be attributed to a down-regulation of immune response and decreased production of pro-inflammatory cytokinase as a result of alcohol consumption. The study also found an inverse dose-response trend that showed the risk of developing RA decreased with alcohol intake between 2 and 4 glasses a week. At consumption levels greater than 4 glasses per week, there was no significant difference compared to non-drinkers, and this was further evidenced by findings that women who drank 8 times per month or more had the same risk levels as those who drank only once or never. The second study we looked at was published in the Journal of Rheumatology on June 3, 2010, and was the first to find a relationship between alcohol and rheumatoid arthritis. The self-reporting study was conducted on 873 individuals with established erosive RA and 1,004 healthy control individuals. The study found an inverse dose-related association between alcohol consumption and risk as well as severity. It also had a decreased risk of RA according to frequency of consumption. Non-drinkers were found to have 4.17 times greater risk than those who drank more than 10 days a month. All severity measures, including C-reactive proteins, 28 joint disease activity score, modified measure of functional capacities, integrated measures of bone and cartilage damage, were significantly reduced with increased frequency of alcohol consumption. These findings are the likely result of lower levels of C-reactive proteins in those who consume moderate quantities of alcohol. This suggests the observed correlation between pain and frequency of alcohol consumption may be a consequence of both anti-inflammatory and analgesic effects. Who is concerned with this issue? The preventative impact of alcohol on rheumatoid arthritis is multidimensional and affects every aspect of health promotion constructs. There are a number of professionals who are both directly and indirectly involved in the distribution of patient education and care. Here we will look at each of these interactions. Organizational. Healthcare providers, educators, insurance companies, and the alcohol industry are some of the larger groups which may see a change as a result of these findings. Physicians are first and foremost in the diagnosis and treatment of RA. The entire range from pediatric to geriatric is pertinent since RA is not necessarily a function of age. Health educators can help with fostering a proper attitude toward alcohol consumption in moderation. It is important that physicians and educators work together to build a supportive, informed environment. Social. There are many social components of alcohol as a treatment for RA. Drinking in moderation is already very commonplace and socially acceptable, which may be due in part to popular media. Health magazines, TV, and internet play an important role in the dissemination of information and the establishment of popular accepted truth. Dietitians are also important in helping patients understand which foods may help ease their symptoms and how to understand caloric content from alcohol. Economic. RA has a significant economic impact. There's a 10% disability rate, 15,600 hospitalizations, and a cost of over $545 million annually to the U.S. economy. There are other costly expenses associated with RA which may be overlooked. In elderly populations or those who experience limitations, caregivers play an important role, such as helping with physical activity, grocery shopping, and meal preparation. Caregivers have added importance for these elderly patients who may be taking a number of medications which have adverse interactions. Physical therapists, occupational therapists, and trainers play an important role in carrying out exercise programs for those with RA and combating the limitations or deformities that may arise from the disease. Of these costs, research may be the least acknowledged but the most important aspect. Political. The political component of RA treatment and the newly established beneficial effects of alcohol is very complex in this realm. Some considerations. State or local governments may benefit from alcohol taxes. Drug companies may lose potentially billions of dollars if drug treatments are less prevalent. Politicians may have allegiances to certain industries or companies which will directly affect policy. Policy. In addition to the political complications, there may be many industries which affect policy. The insurance industry has a large say on treatment options, both pharmaceutically as well as therapeutically. They may be highly involved and concerned with the growing evidence for the beneficial effects of alcohol, since it has traditionally been viewed as detrimental to one's health. Insurance companies may also discriminate when someone admits to being a regular drinker. If policies in practice change, the alcohol industry may also stand to benefit, which may serve as a motivating factor or fund further research. Regulatory. Many agencies such as the DEA, FDA, etc., as well as politicians, insurance companies, alcohol companies, private companies, are all involved in RA research and treatments.
What are the implications and applications for health education and public programming? The Arthritis Foundation is one example of an organization that is currently acting in many spheres. Support groups and blogs for those affected by the disease are available through the organization's website, as well as educational resources that seek to communicate the most current findings to the general public. Donations are collected, and events such as 5K races are organized to raise awareness and funds. Research grants are awarded in efforts to advance understanding of treatment and disease. The Foundation also advocates politically for healthcare reform that better meets the needs of the arthritic population, such as the Affordable Care Act of 2010.
Desired actions. There is significant evidence starting to establish the protective effects of moderate alcohol consumption. Since many women already consume alcohol moderately in social settings, it is a behavior that may in fact be beneficial in regard to decreasing both risk for and severity of RA. Professionals should acknowledge and educate women in the areas of potential benefits as well as abuse. Counseling and support services should not only be for those living with RA, but those who may be dealing with addictions to painkillers or alcohol as a result of its constant pain. Popular media is one of the most common and influential ways information is disseminated. It is important that the most accurate and best possible evidence and suggestions be released to the media to be shared with the population.
Promotion of alcohol as protective for RA is limited by the following. Alcohol is contraindicated for those with certain medications, and consumption introduces new risks of certain cancers, stroke, hypertension, cirrhosis, fetal alcohol syndrome, acutely impaired judgment, and alcoholism. Such risks have also contributed to the stigma associated with alcohol. The public needs to view the anti-inflammatory effects of alcohol as one more tool in the toolbox to fight disease and manage symptoms. Individuals will have to weigh potential benefits against risks, and additional lay translations of scholarly resources are needed to help them do so. Few studies have provided substantive results, though findings seem promising. The British Medical Journal reported the decreased risk within a 95% confidence interval. Additional consistent findings, as well as additional time, are required to communicate this health message.
Motivations of alcohol and insurance industries may be complex and have impacts on research funding and need. If things continue as is, there may be increased reliance on drug treatments, which has high economic cost, as well as decreased quality of life, resulting from decreased capability for physical activity. If preventative changes are implemented, there may be a reduction in later diagnosed cases of rheumatoid arthritis and decreased burdens on society. It may be difficult to implement a treatment that may be potentially hazardous due to the potential for abuse. What is seen as true in mainstream media may not always be an accurate reflection of scholarly research and evidence. And it is also important to remember that children are subject to all forms of arthritis, including RA. It will be important to educate them as to the benefits alcohol may offer when the proper age is reached.
In summary, moderate alcohol consumption is shown to be protective for RA in some cases. Within moderate doses, the frequency of consumption is inversely related to the risk of RA. Optimal consumption for such benefits is 3 to 4 drinks per week to decrease immediate risk by 37%, long-term risk by 52%, and severity of disease. Alcohol is not sufficient to replace traditional management strategies and should be consumed only as directed by one's physician.
Other thoughts. How can preventative approaches be emphasized over reactive treatments? Is it realistic to trust that the general public will consume alcohol in a moderate manner in response to this health message? What are other preventative relationships between alcohol and disease? And are there additional scenarios in which alcohol consumption may not be appropriate?